In this video, you'll get a quick overview of Vibrant's food zoomer. I'll walk through each section of the test, highlighting key features. Then I'll explain the technology used and briefly discuss collection instructions. I'll also suggest synergistic tests and end by highlighting the Vibrant advantage and where to go for additional information. Food sensitivities are immune-mediated, non-IgE allergenic reactions to food protein antigens, in which antigens bind to antibodies and form an antigen-antibody immune complex. Food sensitivities are also referred to as loss of oral tolerance, which is what happens when the intestinal immune system forms immune-based reactions to commonly consumed and typically harmless foods or antigens. This process can also evoke systemic immune responses. However, symptoms of food sensitivities are often delayed and hard to pinpoint or detect. As a result, it's very difficult to associate a specific food with experienced symptoms. For this reason, food sensitivity testing is crucial for identifying antibody response to specific foods and can guide personalized elimination diets. Vibrant's food zoomer gives you a clear, clinically meaningful view of how your body responds to the foods you eat. By integrating precise IgA and IgE insights across a wide spectrum of everyday foods, it helps identify patterns that influence digestion, energy, skin health, and long-term inflammation. With organized domains and actionable clarity, Food Zoomer supports more confident nutrition planning and a direct path towards feeling better. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The Food Zoomer report includes a cover page, an index, a food personalization summary, and then a summary of all the panels. After that, you get a full report for each of the 8 panels included in the Food Zoomer. Each full report includes an introduction, a summary with marker interpretation, and then ends with a list of all the markers. Let's dive in. The cover page identifies the sample type and lists all the food panels and includes the results interpretation key. The index lists the 9 sections of the report, including personalized summary, food sensitivity panel, which measures reactivity to food proteins, and the 7 food antibody panels: wheat antibodies, lectin antibodies, corn antibodies, dairy antibodies, peanut antibodies, egg antibodies, and soy antibodies, which usually measures reactivity to food peptides. This is an important concept, peptides versus proteins, so let's spend a few moments discussing it. Peptides are short chains of amino acids, typically 2 to 50, linked by peptide bonds. Note, a chain of 51 or more amino acids is called a polypeptide. In contrast, proteins are made from 1 or more polypeptides folded into a 3-dimensional shape. These large, complex molecules play many important roles in the body, from red blood cells to enzymes to muscles. The food sensitivity panel measures reactivity to the whole undigested 3-dimensional proteins. Since proteins exist in an aqueous, i.e. watery environment, reactivity to whole proteins is predominantly to the outer, water-soluble portions of the proteins. In contrast, food antibody testing, like the wheat antibody panel, measures reactivity to the small, typically not water-soluble, 2-dimensional peptides created when whole proteins are digested into smaller fragments. Note, antibodies to peptide fragments will not recognize or bind whole 3-dimensional proteins and vice versa. Okay, back to the Food Zoomer report. After the index with the list of all the panels comes the personalized summary. The personalized summary is several pages long and lists non-reactive foods on the left and reactive foods on the right for all the panels. This can be very helpful for patients who just want to know what they can eat and what they should avoid. The summary ends with a summary of all 8 food panels. This lists all the protein-level food sensitivities in the first 3 columns, and the integrated peptide score from the food antibody panels in the 4th and 5th columns. The black triangle reflects the lectin score, and the blue pin reflects the food reactivity score. In this example, the patient is reactive to corn, peanut, and soybean peptides, but their corn, peanut, and soybean lectin scores are low. Additionally, they're reactive to wheat peptides, and their tomato and tobacco lectin scores are elevated. And while they're reacted to lentil proteins, their lentil lectin score is low. If this is confusing, don't worry. We'll return to this concept again throughout this report walkthrough video, and I'm certain it will make more sense by the end. After the food zoomer summary, we get the results of each of the 8 panels included in the food zoomer, starting with the food sensitivity panel. The food sensitivity panel begins with an introduction page. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially if you want to learn about the methodologies used or how reference ranges were established. Next is a food sensitivity summary. This is similar to the food zoomer summary, but it's only for the protein level reactivity to 209 foods and 57 food additives. In other words, no antibodies to food peptides or lectin scores on this page. After the food sensitivity summary, you get the food sensitivity summary comments. Summary comments populate for all reactive foods and include a description, where the food is commonly found, hidden sources, and precautions. The more foods a patient is reactive to, the longer this section will be. The food sensitivity report ends with a list of all 209 foods and 57 food additives tested, including gluten-containing grains, gluten-free grains, gluten-free alternative starches, vegan foods, seeds, dairy, meat, fish, shellfish, mollusks, vegetables, more vegetables, almost 2 full pages of vegetables, nightshades, legumes, lots of fruits, spices, nuts, miscellaneous foods like cocoa, coffee, and hops, then the 57 food additives, including food dyes and pigments, gums and thickening agents, fibrous additives, emulsifiers and surfactants, flavor enhancers, sweeteners, preservatives, and antioxidants, pesticides, elements, and other food additives like BPA and latex. Current and previous results populate side by side, so you can compare the IgA and IgG antibody levels over time. In this example, the patient's IgG antibodies to egg white decreased from 30 down to 20. After the food sensitivity panel come the food antibody panels, starting with wheat antibodies. The first page of the wheat antibodies panel is the introduction page. Again, I highly recommend reading this page if you want to learn about the methodologies used or how reference ranges were established. After the introduction comes the summary. The wheat antibody summary begins with an allergen section. This is where IgE will appear if it's outside the normal reference range. Next come the wheat score and intestinal permeability score. The wheat score is a unified score calculated from the IgE, IgA, and IgG reactivity of the individual to the respective antigens, with higher weightage for IgE than IgA than IgG. Weightage is also assigned to the antigens based on their importance and abundance in the specific food that is tested. The intestinal permeability score is a unified score calculated from the serum zonulin result and antibody reactivity to the antigens in the intestinal permeability panel, which we'll cover next, with higher weightage for IgA than IgG. This considers the tighter value even when the result may be in control. The summary shows the elevated and moderately elevated results along with interpretive comments. In this example, the patient has elevated antibodies to zonulin, actin, and lipopolysaccharide. Zonulin acts as the gatekeeper between cells of the intestinal lining and is considered the mortar that holds the cells together. When intestinal permeability is present, the intestinal lining allows larger protein molecules to get into the bloodstream, thereby causing an immune response. Increased levels of zonulin and anti-zonulin antibodies indicate the presence of intestinal permeability. F-actin is a smooth muscle protein that participates in the contractile belt function of the intestinal epithelial cells. It is also a structural protein which holds the shape of the cell and controls the cellular junction complexes. Increased levels of actin suggest epithelial cell damage, leading to increased intestinal permeability and decreased barrier function. Lipopolysaccharide, or LPS, is a bacterial endotoxin and a major component of the outer membrane of gram-negative bacteria. With intestinal permeability, LPS gains access to the circulatory system, especially when more fat is consumed, and can stimulate pro-inflammatory cytokines to induce cell death. Increased levels of LPS antibodies indicate intestinal permeability and can drive endotoxin-related inflammation. In other words, all three are contributing to the elevated intestinal permeability score of 4.1. Unlike food sensitivity results, which are only reported as numbers, the results for food antibody panels are reported as both a number and plotted graphically, so you can visually see how high or low your patient's results are. In this example, the patient has normal blood levels of zonulin, but elevated IgA and IgG antibody levels to zonulin. This is quite common. Serum zonulin levels can fluctuate throughout the day in response to triggers like gluten exposure and bacterial LPS. In contrast, zonulin antibodies are more stable and provide historical exposure insight. The half-life of IgG is 21 days, so once your immune system creates an IgG antibody to zonulin, it tends to stick around for a while. In this way, serum zonulin levels reflect a snapshot in time, whereas anti-zonulin is more like a report card, reflecting how often zonulin has been elevated in the past months. If you collected a blood sample while fasting, i.e. no zonulin triggers present, zonulin is often normal, while anti-zonulin, which reflects past exposure, can be elevated. Finally, the wheat antibodies ends with the levels of all markers, including wheat IgE, the intestinal permeability markers, celiac markers, the fusion peptide, gliadin peptides, glutenin peptides, non-gluten wheat peptides, wheat germ, and transglutaminase. After the wheat antibodies panel comes the other food antibody panels, including corn antibodies. The corn antibodies starts with an introduction very similar to the wheat antibodies panel, so we're skipping it and going straight to the corn antibody summary. Like the wheat antibodies, the corn antibody summary begins with an allergen section. This is where IgE will appear if it is outside the normal reference range. Next comes the corn score and the markers that are out of range, with report comments providing additional information about the antigens. Note, no intestinal permeability score on this page. Wheat antibodies is the only food antibody panel with the intestinal permeability score. The corn antibodies ends with the level of all markers, including corn IgE, corn pollen peptides, and corn kernel peptides, including genetically modified corn cry proteins. Next up, dairy antibodies. The dairy antibodies summary includes the allergen section, the milk score, and then any markers that are out of range. Note, there are no markers out of range for this patient, so this section is blank. The dairy antibodies ends with the level of all markers, including dairy IgE, casein peptides, whey peptides, and butyrophilin, which is a milk fat globule membrane protein. Let's talk about egg antibodies next. The egg antibody summary includes an allergen section. For egg antibodies, you get both the egg yolk score and the egg white score. The summary also includes any markers that are out of range, although there are no markers out of range for this patient, so this section is blank. The egg antibodies ends with the levels of all markers, including egg white IgE, egg yolk IgE, egg white proteins, and egg yolk proteins. Next up is peanut antibodies. The peanut antibody summary includes the IgE allergen section, peanut score, and then lists all markers that are out of range, like ARAH1 IgG, which is moderately elevated at 2.8 when in control is less than 2. The peanut antibodies ends with the level of all markers, including peanut IgE, Hupin family antigens, Prolimin family antigens, Profilin family antigens, BETV1 family antigens, Oleacin family antigens, and Defensin family antigens. Soy antibodies are next. The soy antibody summary includes the allergen section, the soy score, and then all the markers that are out of range, like GlyM3, IgA, and IgG, which are highly elevated at 4.6 and 4.4 respectively. The soy antibodies ends with the level of all markers, including soy IgE and soy proteins, including the Cry1AC GMO protein. And finally, lectin antibodies. I saved this one for last because it's a bit more complicated than the others. The lectin antibody summary does not have an allergen section because this panel measures more than one food. Instead, you get the lectin and aquaporin scores for tomato, tobacco, barley, green pepper, chickpea, corn, cucumber, lentil, lima bean, mung bean, pea, peanut, potato, rice, rye, soy, kidney bean, and spinach. The lectin and aquaporin summary scores are derived from a weighted average, not an exact average, calculated in part based on the reference range, on the weight of the analyte in the sample, and the titer intensity. The score cannot be calculated directly based on the food's IgA and IgG results. But before we go on, what are lectins? Lectins are naturally occurring proteins found in many plant foods, especially grains, legumes, nightshades, and seeds. Their biological role is to help plants defend themselves from pests. In humans, lectins can bind to carbohydrates on the surface of intestinal cells, resist digestion, allowing them to interact with the gut lining, disrupt gut barrier integrity in susceptible individuals, and activate the immune system, leading to antibody production. When the immune system recognizes lectins as a threat, it may produce lectin-specific antibodies, even if the person tolerates the food itself. The key distinction here is you may not be reacting to the food as a whole, but rather to specific lectin proteins within that food. Now let's talk about aquaporins. What are they, and how do they differ from lectins? Aquaporins are specialized proteins that form water channels in human cell membranes. They play a critical role in regulating water transport, supporting cell hydration, and maintaining tissue integrity, especially in the gut, brain, kidneys, and immune system. Aquaporin 4 is the most relevant aquaporin channel in humans. Note that aquaporins from food sources have structural similarity to human aquaporins. So when antibodies to food aquaporins are present, through molecular mimicry, those antibodies could mistakenly attack human aquaporin, causing neurological symptoms. Therefore, patients with antibodies to food aquaporins may benefit from the neural zoomer if neurological autoimmunity or cognitive decline are suspected. Okay, back to the food zoomer report. After the lectin and aquaporin scores, you get a list of all the reactive antigens. In this case, the patient has elevated IgA antibodies to tomato aquaporin and tobacco aquaporin. The lectin antibodies ends with the level of all markers, including lectins and aquaporins. Now, let's talk about methodology. Vibrant uses a proprietary protein microarray to quantify antibodies to food proteins, peptides, lectins, and aquaporins. To help you better understand this methodology, I will explain how Vibrant makes the 3-dense microchip used to run this test. But first, please note that the microarray utilizes ELISA methodology. ELISA stands for Enzyme-Linked Immunosorbent Assay, a commonly used laboratory technique. However, instead of 1 antigen per well, Vibrant can measure up to 100 antigens per well. Looking at steps 1 through 3, this is possible because Vibrant attaches antigens to silicone semiconductor wafers. This allows for the bulk manufacture of thousands of identical chips per wafer, creating the ability to scale to volume. Looking at step 4, Vibrant then dices the wafers into tiny microchips. In step 5, Vibrant uses automated machines to arrange the microchips, 1 for each antigen, in a 10 by 10 grid atop one pillar on a pillar plate. The pillar plate is then flipped upside down and submerged into a well of the patient sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Again, each pillar can measure up to 100 analytes because it is a 10 by 10 grid. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. In summary, this automated process allows for high throughput, sensitive, and specific analysis of multiple biomarkers for minimal sample volumes. Finally, let's review the collection process and key preparation considerations for food zoomer testing. Vibrant's food zoomer is a blood test. Blood can be collected via blood draw, usually done by a phlebotomist. And note, this test requires 2 tubes of blood. Or it can also be ordered via the at-home menu and collected via dried blood spot, commonly referred to as DBS. Note, this test requires patients fill 4 dried blood spot cards. Each card has 5 spots to fill, so that's 20 total blood spots. A detailed video how to collect the DBS sample is linked in the video description, which can be shared with patients who require a full walkthrough. As for timing and pretest conditions, blood samples may be collected at any convenient time of day unless otherwise instructed. Fasting is not required. However, for optimal and clinically relevant results, patients should maintain their routine diet, medications, and supplements unless specifically instructed otherwise by their healthcare provider. As with all testing, patients should consult with their healthcare provider before making any lifestyle changes, including changes to prescribed medications, dietary restrictions, or supplements. Before I share synergistic tests, I'd like to introduce you to Dr. Sidney Baker's TAC rules. Rule number 1. If you are sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to Vibrant's food zoomer, also consider the gut zoomer, which adds digestive and barrier context, helping clarify when food immune response may reflect dysbiosis, impaired digestion, or mucosal stress rather than the food exposure itself. Also, cellular zoomer, which adds metabolic and oxidative context, helping determine whether food immune activity aligns with cellular stress patterns affecting energy production, recovery, redox balance, or neurochemical stability. Also, the immune zoomer, which provides tissue-level immune context and helps assess whether food-related immune signals coexist with broader immune activity involving joints, nerves, thyroid tissue, or systemic inflammation, supporting informed clinical correlation. And finally, the hormone zoomer, which brings endocrine timing into view, helps clinicians evaluate whether food-related immune patterns intersect with cortisol rhythm, sex hormone metabolism, or stress signaling that may influence symptom expression. In summary, Vibrant's food zoomer uses highly specific and sensitive microarray methodology to clarify food-driven immune patterns that are easy to miss when symptoms are delayed, inconsistent, or random. The Vibrant advantage is that the food zoomer measures reactivity to an expansive list of food additives, lectins, and aquaporins, turning elimination diets from trial and error into a focused, sustainable plan. Targeting both food proteins and peptides to clarify which part of the food is driving the signal, and whether improving digestion can help resolve it. Because if you're reactive to whole food proteins from the food sensitivity portion of the test, that usually indicates you're not digesting well. And once you fix that, then the immune system won't be seeing those whole food proteins anymore, it'll only be seeing the digested peptides. Additionally, dual isotope insight, so looking at IgA and IgG, separates mucosal versus systemic immune patterns, critical for interpretation beyond IgG-only panels. Overall, this enables faster clarity when elimination diets stall or become too restrictive, also more confident identification of high-impact foods, a cleaner reintroduction strategy to rebuild tolerance and dietary variety, and better patient adherence because the plan is specific and not vague. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.